Welcome. Thank you for joining our Medicare member webinar. My name is Ryan Dolan. I am the Medicare Field Sales Manager here at Univera Healthcare. Been with the organization for about 10 years, all in the Medicare space. I do reside in Rochester with my wife and two children. But thankful to have everyone here today. Thanks for taking your lunch hour and spending about an hour with us. Just a couple reminders that today's event is designed for individual Medicare Advantage members. If you receive your Medicare plan through a current or a former employer, you're certainly welcome to listen. Just know that some of those benefits may vary from group coverage to an individual plan. Over the next hour, we're going to help you learn more about your Medicare Advantage plan benefits, including medical, dental, vision, pharmacy. Definitely grab a pen and paper, take some notes throughout. It's a lot of content. Before we get started today, you'll also notice that for your privacy, your mics have been muted and your cameras are off. If time allows for it, I'll rejoin here at the end and we will do some Q&A at the end of the presentation. So throughout, if you have any questions, please do drop them in the Q&A portion of the Teams chat. Know that if we do not get to your question or if you think of something after this event ends, you will receive an email where you can request additional support. This session will also be recorded and available online within the next day or two for reference. So next, I'd like to introduce you to our panel of speakers today for today's virtual webinar. Leading us off is Mike Montgomery. He is a Univera Medicare consultant. He's been with us for 8 years. He is a lifelong resident of Western New York, residing in Amherst with his wife, Michelle. They enjoy golfing and spending time with their family and friends. Mike also has 3 grandsons who are pretty good at bringing smiles to their faces. Next, we have Sarah Wise. She is a Medicare product manager. In her role, she is responsible for guiding strategy for the Medicare line of business. Sarah's been with the organization for 3 years and lives in the beautiful state of New York for all 3 of those years. And she resides with her husband and 3 furry family members. Next, we have Dr. Garg. Dr. Ankit Garg. He is a practicing internist and vice president of medical affairs. He has been with the organization for 3 years as well. He resides with his wife and 3 children in the town of Pittsburgh. And last but certainly not least, we have Danielle Brunswick. She is a clinical pharmacist for our Medicare Part D formulary manager. In her role, she helps develop and maintain the coverage prescription drug list and follows all CMS regulatory requirements. So she manages our formulary. She has worked here for over 12 years. She is a lifelong resident of Western New York, residing in Clarence Center with her husband, son, and their 7-year-old Cavapoo named Turk. She is also an avid Bills fan, so I'm sure we got a few Bills fans on the call today. Go Bills! And with that, I will transition it over to Mike. Mike, take it away.
Thanks, Ryan. Appreciate it. As we get started here, I just want to kind of echo what was said by Ryan. I want to just thank everybody that's on the call today for trusting us with your healthcare needs. We don't take that lightly. We work very hard every day to earn that. And today is really kind of designed more as a reminder of maybe some of the benefits that when you initially signed up, you weren't aware of, or you weren't maybe as important to you at that point. But maybe as we go through this, you'll find a few things that kind of jump out to you and say, oh, I didn't know that. And yeah, I should probably do this or whatever. All right. So let's go a little background. 1986 was the first year that one of these Medicare Advantage plans were offered. Univera was the first carrier to actually offer that product. You'll see our ads on TV now. We've changed our tagline where it says right here for you. And the reason we did that is because we live in this community. They're actually in our compensation plans every year. There is a volunteer piece that you get certain time off to volunteer at different organizations. And you've probably seen us with Habitat for Humanity, Backpack for Kids, Feed More Western New York. So, we live the same, we breathe the same air as our members do. And I think that's important. And we're going to talk a little bit more about like access to our customer service department and different things like that. And I think you'll see that we feel as though that's a huge advantage for us. So, speaking of the service area, you have to live in one of the 8 counties of Western New York, but because of our association with Excellus Blue Cross Blue Shield, you have 6 counties in Rochester, 5 in northern Pennsylvania. So, as an example, if you needed surgery and your surgeon was at Strong Memorial or U of R, that's in our network, and you would pay a network in-network copay or co-insurance, depending on what the circumstances are. Same thing down in the southern tier. We have 3 counties down there: Allegheny, Chautauqua, and Cattaraugus. And a lot of times people will not make it all the way back up to into Buffalo, so they have the access of the 5 counties down in northern Pennsylvania. One of the things that we are really happy about this year that we added to our PPO plans, and I'll define those in a few minutes, the difference between those HMO and a PPO plan, is we added a multi-plan, which is a national network. Multi-plan is currently going through a name change. They're now going to be known as Clarative, but this gives you the opportunity anywhere in the United States pretty much where you can go and see a physician or a facility and you'll pay in-network benefits for that situation. I always use my brother-in-law as an example on this. He's got a heart condition. He lives in Buffalo for half the year. The other half of the year, he's down in West Palm Beach. He doesn't come back to Buffalo, in February to see his cardiologist. He sees one down in Florida. So that, in effect, that's really kind of what a PPO plan does. It gives you a much broader network. Where to go for support? Well, if you're working with a broker, obviously you can call them first, or you can reach out to myself. I'm one of the Medicare consultants along with Michelle Richin here in Buffalo. You have customer care. You'll see the number listed there. They're available pretty much from 8 in the morning till 8 at night, Monday through Friday. And during open enrollment, they're actually there on the weekends as well. And then we have 2 resource centers. One of them is located here in Leonsville, which is at Park Club Lane. The other one's down in Jamestown. And I think the next slide, if memory serves, yeah, here we go, shows the picture of the folks, the phone numbers, the hours, and so on and so forth. So what I encourage people to do is if you have a question on a bill, or maybe you need a referral to a specialist and you're having some difficulty, you can reach out to us through those sources that I mentioned, or obviously you can come right in and talk to somebody live in person. We're here 5 days a week. I believe the last time I heard, I think we have about 565 employees here at Univera, but on a daily basis, there's probably about, 20 cars maybe, but we're here. So if you need us, come on in. We urge you to do that, or at least pick up the phone, give us a call, and we'll be happy to try to address those concerns. So let's talk about enrollments, when you're eligible, when you can make the changes. So I think pretty much everyone on the call today has already signed up for Medicare, but just as a refresher, whether it's maybe a family member, a neighbor, this type of thing, you have your initial election period. This is the 3 months prior to the month of, and then 3 months after you turn 65 to sign up for Medicare. You also have your annual election period, and I think everybody pretty much understands that as well. That runs every year from October 15th through December 7th. And this is where what will happen is you can come in, talk to us. If there's changes in the plans, we can review the plans with you, see what your circumstances might be. So any change that you're going to make, you're going to be able to make that effective for January of the following year. A special election is something, obviously based on the name, is special. Means you're on a group plan now and you're coming off of that group plan, and you can do that anytime throughout the year. You don't have to wait until annual election period. You can do it at any time. Also, if you're moving out of the area, or maybe a spouse and you've got the insurance through your spouse and they lost their coverage, those are all reasons we give you a special election to enroll in a Medicare Advantage plan. And then finally is the period that we're in right now. We're kind of coming to the last month of it. Every year from January 1st to March 31st, you have something called open advantage enrollment period. I'm killed the name on that, but you understand what I'm trying to say. It means if you've been enrolled in a Medicare Advantage plan and and did make a change during annual election, you want to make it now, you can do that. Or you can revert back to original Medicare and you can start that process and look at a supplement and all that. All right. All right, so what did we change this year? A couple of things that we're pretty happy about. We already talked about the multi-plan network. That was huge, I think, for us. With it's only to the for the PPO plans. There's an access and there's a PPO core plan this year that we've introduced. It's kind of a hybrid. It's in between a Medicare Advantage plan and a supplement. But with the PPO access plan, there's a $250 flex card that can be used for dental, vision, or hearing benefits. You can't use it for a copay, but you can use it for an actual service. So if you needed glasses, and I don't know anybody that can get a pair of glasses for $100 anymore, but I mean, you could, if you had the PPO plan, you could use that flex card toward that. You'll see in the bottom too that there's free hearing exams every year, routine through True Hearing. That's the vendor that we use. You also have Fit On. Sarah's going to talk a little bit more about that. It's a new vendor that we picked this year for our fitness piece. And then you have routine physicals, that are covered at no cost. And, again, over the counter for at least $200 a year for every HMO plan that you might be enrolled in, I should say. The way that it works is you get a catalog, and the company that we use is Convey Health. I'm sorry, I mispronounced. Convey Health. You get a catalog, you can fill it out, you can go online, you can order. So if you're needing your vitamins or Band-Aids or cold medicine or any of that kind of thing, you have that built into your plans automatically. So again, something to kind of think about. A lot of people don't realize that. They come in maybe after the first year that they've been signed up with us. You mention it, and they're very enthusiastic about that opportunity. All right, so types of plans. I already mentioned the PPO plan. With a PPO plan, it's really that for someone that's going to be out of network for some of their services for at least what I usually suggest at least a few months of the year, maybe. You don't need to have a primary care physician. There's no referral access to specialists. You don't have to worry about any of that. Flip the coin over, you have an HMO plan. And we have an HMO and you have an HMO POS. The POS stands for point of service. It gives you some of the outer area, but not as much as a PPO. But with an HMO, we do require you to have a primary care physician associated with the plan. That way we can kind of help drive anything that that you may need through your primary care physician to coordinate your health plan. You're generally going to need a referral to some specialists, and there are copays for most of your services. I guess the best way to understand it, and the way that I usually try to explain it, is if you're getting all of your services within the 8 counties of Western New York, or the 6 in Rochester and 5 in Northern Pennsylvania, those 19 counties, you're probably looking at an HMO plan as the fit, because the one thing you have to understand on all of our plans is you have emergency room anywhere in the world, urgent care anywhere in the world. So those are also things that people will ask, hey, I'm going down to Virginia to see my son, my daughter, whatever. If I cut my hand, what do I do? So those are built into all of our plans as well. And these are really just reminders. Again, I'm a big believer that each person has to decide, based on their situation, what plan kind of fits. And, we'll be happy to kind of have those conversations throughout the year. It's not just through open or annual election period. If you have a concern or a question, you want to come in, you want to talk, we're here for you. These are just a few of the other benefits and perks that we are included in all of our plans if you sign up with Univera. And I always point 2 things that I like to talk about. And one of them I just did, which is the worldwide urgent care and emergency room. The other one is going to be the telehealth. Telehealth, it's hard to believe, but it's been, I guess next month, it'll be 5 years when we first heard the word pandemic, COVID. People started working from home. People were afraid to leave the house. Telemedicine was a huge advantage for folks back in the day. and it still can be used. So like if you're in a different state and you're having a situation, you want to talk to a physician, you can do that. They can script over the phone. So there's a lot of reasons that, that we have that included in all of our plans, and some people are not aware of it. And that's the reason that I wanted to kind of bring it up here. We're going to talk about some of these other benefits. Sarah's going to talk more about the fit on. The preventative vaccines are included. So that's under your Part B, your COVID, your shingles, your flu shots, all those types of things. We're going to talk about dental too in a minute. But these are some additional benefits as well. And I only call them out because some people are not aware of the fact that we have this additional, I guess, service, if you will, benefit for lack of term, I guess. REACH is going to be for somebody that has a chronic kidney disease. So it's really designed to prolong somebody's health or life. Void health is musculoskeletal, where you will actually talk to a physician, an orthopedic. They can give you an exercise plan. They can do it either virtually or they can do it over the phone. WellBe is something else. That's going to be somebody that has a complex health situation. Usually they have more than 7 chronic conditions and are more than 12 scripts. You're going to work with our care management team to try to help ease some of those concerns, so your focus is trying to get better. We also do a home assessment. There's a reward there for that. If you complete it, it's a $30 Amazon card just by going online and doing it. And I'm going to talk to you in a minute about how to sign up for that. And then finally, the rewards and incentives. I mentioned the PPO plan. The Access plan has a $250 flex card. There are also some things that you can do throughout the year where you can actually earn another $100 toward that, bringing that up to about $350 a year. So what might be an exercise program, might be monitoring blood pressure. Those types of things are going to be part of the equation. The dental, there are 2 parts to it. There's preventative and there's comprehensive, as you can see. The preventative is if you're working with an in-network dentist, you get 2 cleanings, 2 office visits, and a full mouth x-ray, no cost to you. Comprehensive is going to be everything above and beyond that. So if you're getting your teeth cleaned and the dentist sees that you've got a cavity, they want to fix it, or you need a crown or a root canal, you have the comprehensive piece that's going to take care of that. The preventative does not count against the comprehensive. The comprehensive gives you a full $1,000 on top of toward those benefits. So that means if you went into your dentist's office and you needed a crown and that crown was $1,200, Univera would pick up the first $1,000, and then you'd be balance billed for the other $200. So again, I think it's a huge advantage. It's been in our plans now for the last couple of years. Seems to be a real crowd pleaser for people. And again, it's only meant, this is really just as a reminder. We're not telling people you have to do it or not do it. It's more just you may not be aware of the fact that this is the circumstances that are in all of your plans. And then again, with the hearing and the vision, we use True Hearing as our vendor for the hearing. It's a zero copay if you get your exam there. And depending on what type of hearing aid you might need, whether it be the advanced or the premium, the advanced copay would be $4.99 and the premium would be $7.99. That's per ear. So again, depending on your circumstances, I think if you went out and bought a premium hearing aid now, you're talking thousands of dollars. Here you're going to be limited to that $7.99. And then again, the annual routine for the vision. If you're going to an in-network provider, it's a zero copay, and you get at least $150 a year toward lenses and frames on any of the plans. Some are more, some are less. So again, if you have questions on that, you want to call the stop in, we'll be able to help answer those for you. And then finally, the last slide that I'm going to talk about here this afternoon is really just how to create an account. It's really designed for you to take control of your situation. It's really easy. It's a 5-step routine. You can see it right here. You're going to go on, you're going to log into it. You're going to, put your information in. You're going to create a password. You're going to be able to pay your bills, see a claim, view any kind of cards that you may need. If you lost an ID card, that type of thing. So it's a real benefit. It's a real easy thing. And I think more and more people are starting to get acclimated to using the internet to kind of help ease some of those questions. So with that, I'm going to turn it over to Sarah, and she's going to talk to you about Fit On.
Thank you, Mike. I appreciate it. Okay, so it is so great to be able to speak to everyone today about our new fitness vendor for 2025 Fit On. So the great thing about this change to this new vendor is so much of what you love about your fitness benefit stays the same. You still receive this benefit at no cost to you, and you also have access to thousands of fitness facilities. However, with the new vendor, there are some exciting extra optional perks for you to take advantage of if you'd like to. These include access to fitness classes like yoga, at-home fitness items that you can order, unlimited access to FitOn's online content, and they have all kinds of stuff like recipes, meditation classes, a lot of like really cool content out there, and also an out-of-network benefit. On the next two slides, we just want to give you some examples of how you might want to utilize your fitness benefit just through these member personas. Again, just giving you ideas of how you can utilize your benefit to fit what your fitness desires are. So in this first slide, David used his fitness benefit through Silver and Fit to get a membership to the YMCA. And he just wants to continue to use that benefit. He just really likes going to his YMCA, doesn't really care about the online content at this time. So the good news is he doesn't have to do anything to keep his membership active. So David should have received a letter confirming the transfer of his membership from Silver and Fit to Fit On. This means that all he has to do is set up to continue to go to the Y. He has all he needs that's set up to go to the Y interrupted. Excuse me. And if he didn't receive the letter, then he can go forward and set up his Fit On account and enroll into a fitness membership. So he can enroll into his YMCA. And we'll get to the Fit On account setup later in these slides. But again, if he received that membership transfer letter that says that his membership transferred over, he's good to go. The next slide, we have Maria. So she's a new member. She's very excited about this new fitness option that's available to her. So she decides to sign up for a Fit On account and selects her local gym for her monthly membership. Those credits that are required by for the membership are deducted automatically based on the gym that she selects. So different gyms have different credit requirements, which we'll go to in the next slide. Maria also wants to try maybe some other classes. And so she decides to browse the Fit On site and select the ones that fit her credit allotment and what she's interested in. There's also free online classes and resources that she can take advantage of. Like I said, there's a lot of content out on the Fit On platform. So next, getting into credits, and this is a little bit something unique to Fit On, but hoping this slide will help everyone better understand them because they're definitely something new. So let's walk through how the credit system works. Every member gets 36 credits per month to use on fitness activities, and these are automatically loaded each month to your account. They do not roll over, meaning any in-use credits at the end of the month disappear, and a new bank of 36 credits are added the first of the next month. So going back to Maria and how she would like to use her credits, Maria decides to select a gym membership that costs 20 credits per month. 20 credits will be deducted monthly unless she goes back in and cancels that membership. So that's a good thing to remember is once you enroll in a membership, those credits will be deducted automatically each month until you go back in and cancel. So after that membership, she has 16 credits remaining, and she decides that she wants to try out a yoga class. So she finds a yoga class, finds out it's eight credits, and she registers and attends that class. She has 8 credits left over. She takes advantage of some of the meditation videos and some of the short online classes available within the Fit On platform. And as we said before, these are at no extra cost for you, and no credits will be deducted. It's just free content. She ended up loving the yoga class, so she signs up again, and her account is deducted those 8 additional credits. So that uses up her credits for the month, and she'll get a new set of 36 credits the next month. Keeping in mind that those 20 credits, if she decides to keep her gym membership, will be deducted from that 36 credits. So next we'll go into the account setup. So when you're wanting to set up your account with FitOn, you'll want to access your account first by logging into your member portal. And Mike just went through that process. So you'll want to get that set up if you haven't already. But if you do have it set up, you'll just want to log into your member portal. Sorry. From there, you'll go through a few steps to navigate to the FitOn member portal. So just like selecting health and wellness and then FitOn health. And then again, this is just another piece of where you need to go to get to your account. So go select FitOn health. And then you'll get to this screen, press let's go. And then this leads to our first screen in setting up your FitOn account. Do know when you're going into this piece that you'll want to have your member ID handy, because you'll want to match some of the information off of your member ID. So on this screen, this is an initial screen that you'll want to enter in your email and password. We recommend using the same information that you use for Univera member portal, just because, make it easier for you to remember, because we all have so many passwords for everything. So you will also, just to know that you'll be also able to use these credentials that you put in here for the FitOn app. So if you just wanted to use the FitOn app later, after you complete the registration, you can use these credentials that you put in here. On this screen, you'll see your name and zip code. Now, this is where you want to use your member ID and put in your name exactly how it is on your member ID, and then use the zip code that you get your mailings from us. Also, for a lot of this stuff coming up for personalization, you can use estimations on your height and weight, and it's these upcoming questions are personalization, so just don't worry too much about them, and estimates or guesses are just fine. So again, these are just more personalization questions that we're going through. And I know there's a few pages, but just do the best that you can on what your goals are, because this will help have you have a better experience with your FitOn account, because it tailors the account better to you. And after you get through those personalization screens, your account is ready. And at this point, you can join a gym, attend a class, or utilize the online account after you go through that registration. And just want to point out that you do want to go through all screens, so your registration will be fully complete. Now, if you need any help anytime, we at Univera are here to help with any registration issues that you have with like your Univera account. If you need help with the FitOn registration piece, their customer care are here to help you. They're also a great resource for helping you select a gym or any other questions that you might have with the Fit On platform. Uh, and then I think that wraps up the presentation on Fit On. But at this time, I'll pass along the presentation to Dr. Garg for him to discuss preventative care with you.
Thank you, Sarah. Um, Wonderful to get an overview of all these benefits, especially, I mean, it's a good reminder that all these benefits are available to you as part of your Univera health plan, and this is over and above, the regular Medicare would have offered if you would have just stayed with regular Medicare. Again, I'm Dr. Garg. I'm a practicing internist, and I'm board certified in internal medicine. And we're going to talk about, how to get ahead in your health journey, how to make health your priority, and what are some of the things that you can do, especially while we are early on in the year, to get ahead and take charge of your healthcare. So one of the first things that I want to talk about is the annual care visit. Now, there are a couple of different types of annual care visits. There is wellness visit, and there's something called annual physical. And I just want to talk a little bit about, what the difference is, because sometimes you go in and thinking that I may or may not get a bill, and this should be like completely covered, and you end up getting a bill. A wellness visit is essentially a preventive visit where you and your provider work together to create a long-term plan to help keep you healthy. And this is mostly, the questionnaire back and forth, going into your personal history, your family history, your vaccination history, your medical history, surgical history, and your labs, and create a plan which is specifically designed to keep you healthy. It does not include physical exam. So this is where it differentiates, and your annual physical is a more of a hands-on exam of your body to check on your general health, look for any potential problems, and so whenever you call your physician, um, you know, usually you get a wellness visit once a year, but depending on your needs, depending on your individual, medical conditions, your physician might decide whether to code it as a physical versus a wellness visit. And you may or may not get a copay or a co-insurance, if he decides to do, for example, an EKG, because it's required as part of your prevention, or if you need some blood test, if you need some imaging studies, there might be some copays or co-insurance involved with that. Now, there is one other type of visit which is called new to Medicare visit, and it's only available for new Medicare members, and it can be completed within the first 12 months of enrollment. Now, one of the things that your physician is going to touch on during your annual care visit is these different types of screenings. Now, there are a couple of different types of screenings. There is screening for cancers, and then there is screening for medical conditions. So you may be very familiar with colorectal cancer screening, where you have different modalities. You have the traditional colonoscopy option, and then you also have, the Cologuard option, and there are a couple of other, options there. Um, um, and then, as far as medical conditions is concerned, your physician is going to order blood tests to check if you have diabetes or if your blood pressure is high. Those are the things that you want to get ahead of. Sometimes, some people are more prone to get hyperlipidemia based on their medical history. They might check your cholesterol. Thyroid is another one of the common, a blood test included in as part of your screening. Um, Now that's all part of like, knowing your numbers and kind of like understand where you stand in terms of, all these different common chronic medical conditions. And if you do get, close to getting them, or if you do get diagnosed with them, you want to get ahead of them by starting early on the medications and the treatments. Now, talking a little bit about osteoporosis. Now, that's one thing which sometimes is um, um, overlooked. I should say. It's a disease that thins and weakens your bones. It makes your bones more fragile, but it's a completely treatable, uh, condition. And one of the things that you can do is to avoid those fractures that sometimes you might have heard of with completely innocuous falls. Those fractures can be avoided if your physician gets ahead and screens you for osteoporosis and kind of treats it ahead of time, so that you don't get into those situations where your bones become brittle. Now, for women specifically, there are, mammograms, and you should definitely get an OBGYN visit every two years. That's again, part of your regular preventive care. And for men, prostate cancer screening is another one of the big ones, especially if you're between the age of 55 and 69. It's really important to talk to your physician and decide if the screening is right for you, because prostate cancer is one of the most common cancers. Now, another thing that your physician is definitely going to talk to you about during your visit is immunizations or vaccines. We all know that vaccines saves lives, and even for otherwise healthy people. And most of all of the vaccines, especially like the preventive vaccines, are available at no cost to you. That may include, a flu shot, a pneumonia shot, a tetanus shot, shingles. Again, very painful and a completely preventable thing. Especially if you're above 50 years of age, you might be eligible to get it. And if you want to see a full list of recommended preventive screenings, please go to our website, medicare.univerahealthcare.com. It might help you to just familiarize yourself and get ahead of it. Now, let's talk a little bit about, once you set up that visit with your provider, how do you want to prepare for that visit and what do you want to discuss? There are a bunch of checklists available online, and I'm sure you have seen those. I don't want to get into like all each and everything that may have been included in those checklists, but want to highlight like a couple of things which are important. Especially as a physician, I feel like patients who bring all of their medications with them, it really helps me to uncover surprises. There are sometimes medications that they're taking which are not correct dosages, or medications which have been discontinued a while back, but you might still be taking them. Those type of situations are uncovered when you make it a habit to take all your medications with you. Another thing to do to prepare yourself for those visits is having a list of questions. Specifically things that you're bothered by. You may not be able to get everything discussed during that visit, but if you're upfront, then your physician might be able to take a look at those lists and be able to like identify some of the ones which may put you at imminent danger or may require more immediate assistance. Now, this slide also has, what what we call like, some of the uncomfortable topics that you may want to bring up during your visit. And these are really important, and I'm going to go one by one through them to just discuss the importance of, why it is really critical to bring it up for discussion. The first you see up there is memory. So if you're having any kind of like forgetfulness, be honest with your provider and talk about any issues you're having, because dementia is really common, and you do not want to just ignore that, thinking that it might be a normal age-related memory change, because there are medications that you can take for dementia which can slow the progression. Um, Falls, again, can be really embarrassing for people to discuss that they're having, falls, but it's really important to bring that up with your physician, because it may uncover, some sort of a cardiac condition, and you don't want to get into end up in a situation where you're in an emergency room and getting things done on an urgent basis, when you can get ahead of it by discussing it proactively. Another very common issue is incontinence. Unfortunately, what I have seen is it's very difficult for patients to bring that up for discussion. But again, like it's puts you at risk for urinary tract infections, and sometimes you end up in the emergency room with urinary tract infections spreading to your body. So you don't want that. And also, there are treatment options available now, including, you might get a referral to a specialist, and get ahead of your incontinence. And last but not the least, mental health. If you're feeling lonely, if just pretty common. It's important to talk to your physician. They can help differentiate your loneliness with something more advanced, like a depression, where you can have a medication prescribed. Otherwise, they can help you with some strategies and how to overcome loneliness. Now, how do you find a provider? Now, most of you, I believe, would already have a primary care physician, but just for some of you who may not have a primary care physician, we just I think Mike just discussed like how you can create an online account for yourself, and once you create that online account, you can search for a specialist, for a primary care physician, for urgent care, for a lab. Just type in your zip code, and you should be able to find one in your network close to your house. And some of you who still prefer the old way, of talking to a person, you can always call this number. Customer care is available Monday to Friday from 8 to 8, and during those open enrollment periods, it's available on the weekends as well. Now, you may or may not know this, but all Univera Healthcare members also have access to care management team. And our care management team is pretty big. Believe it or not, we have about, I would say, like give and take, about 200, nurses, registered dietitians, social workers, behavioral healthcare managers, physical therapists on staff who are available, who are employed just for you. So if you have, any kind of, specific healthcare related questions, then they can certainly help you. Some of our nurses are especially trained for things like, transplant or cancer care navigation. And of course, you see the registered dietitians. If you're a diabetic, if you're a new diabetic specifically, then you can take advantage of talking to the registered dietitian, and they can help you kind of, in the initial control of your disease. Along with care coordination, they can also help you with chronic condition management. If you have a complex condition like a cancer, then you can always reach out. And then of course, the behavioral health managers can help you if you have things like, substance use disorder or a mental illness where you're, not able to really find the support that you need because of, access issues. They can always provide you with the education support and community resources. I'm going to pass it on to Danielle at this time. Thank you again for joining, and thank you for being our members.
Hi, thanks, Dr. Garg. That was great information. I'm going to go through my topics kind of quickly based on the time we have left here. First, just want to touch on the topic of how your prescription drug coverage, works. Explain more about the phases of the benefits, as well as some changes to the structure of your Part D benefit that are taking effect in 2025. This might be why you pay $10 to $14 for your Tier 2 drug one month and then $0 the next. This is probably why. You have 3 phases of the benefit: initial, deductible, initial, and catastrophic phase. Last year, there used to be a coverage gap phase in there. So when you enroll in one of our Medicare plans and you go to the pharmacy, you either pay a copayment or co-insurance in your initial phase based on the tier level of the drug. So when you get to a maximum of $2,000, I did want to back up and say, yeah, members now have a maximum of $2,000 out of pocket for Part D drugs. This is brand new for 2025. You will pay no more than $2,000 for your Part D drugs throughout the calendar year. It resets annually, so every January 1st. So once you've met, if you even meet that max $2,000 out of pocket, you move over into the catastrophic phase. In the catastrophic phase, you have a $0 copay, and once you reach the catastrophic phase, you remain there for the rest of the calendar year. If you're taking a number of prescription drugs, we can sit with you and look up the cost of the drugs, getting a running total estimate for you, so you're completely aware of how the year could look for you, and where you might meet that maximum if you would. Formulary changes. So what's a formulary? It's a list of our covered medications. You can find this information on our website at medicare.univerahealthcare.com. Some drugs, so each year a formulary can and probably will change. Medications can change tiers. They can cost more or less each year. They could be added or removed from the previous year. And then obviously new drugs that come out throughout this year are also reviewed and added, if appropriate. As always, we encourage you to check our website. We have a lot of great information under the prescriptions tab on the website. You can see here there's under prescriptions, you can go to check our drug lists. From there, you'll be able to see and click on your specific Univera plan that you've chosen. Or you can even look at, there's a searchable drug link. So instead of looking at the PDF of the formulary, you can click on the searchable link, type in Lipitor or type in atorvastatin, and it will tell you what status is on the formulary. Also on that page, if you scroll down further, there is a list of formulary changes. So you can see when drugs might have been added or removed. What hasn't changed in 2025? Things you can still count on are your $0 tier 1 generic drugs, and not just generics. There are some vaccines in that tier 1 level as well. The Part D vaccines, such as Shingrix for shingles, and the RSV vaccines, Arexvy and Abrysvo. And also something that hasn't changed is insulin costs. You don't pay more than $35 for a 30-day supply of any insulin. Some may only pay $25, some may pay $30. And if you happen to get a 90-day supply, you get the benefit of only paying 2 copays. So, looking at the time, I'm just going to go over this quickly. The takeaway here is that there are no changes from 2024. Univera has maintained a preferred pharmacy network. What that means is that you can go to any one of the 66,000 pharmacies that are in our network. Over 35,000 of them are what we consider preferred pharmacies, such as Walgreens, Walmart, Wegmans, Tops, some independents, and the other pharmacies in our network are considered standard pharmacies. Well, what's the difference? That you have a members experience an average of a $5 copay savings per prescription per month when using a preferred pharmacy. You also have the option of getting your prescriptions, mailed directly to your home, which I find comforting this time of year, not having to go out in the snow and ice. So, one thing, based on income, it's really important to let you know that there's extra help available for your prescription drugs. We have state help through New York State EPIC program. There is a phone number there you can call. I always say, even if you think you might be eligible, give them a call. They'll be able to have you apply, which is free of charge to apply, and see what you qualify for. Okay? This can actually lower your prescription copay dollar amounts. It could lower your monthly premiums. And if you are in EPIC, it gives you that special election period should you need to change your coverage throughout the year. That's not within that annual open enrollment period. There's federal help from the Social Security office. The phone number's there, or you can even call 1-800-Medicare and help you apply that way to see if you're eligible. And lastly, probably not leastly, is if for qualified veterans, there's also coverage through the Veterans Affairs. Well, going back to what's new in 2025. So even though you have a maximum out of pocket of no more than $2,000, and we're finding most of our members won't hit that, we know that's still a lot of money. So we have the Medicare Prescription Payment Plan. What is that? It is a voluntary opt-in plan that helps you budget your prescription drug costs throughout the calendar year. So the program might benefit you if you have high covered, costing Part D drugs, that you're going to hit that $2,000 maximum, before the summertime. And you kind of want to help budget that money throughout the year. It might not be right for you if you have consistent or low copays every month. So there's really no reason to budget that amount if you're just paying a $0 or $10 copay each month for your drugs. And this program may not be right for you if you already qualify for extra help, because those are also low monthly copays. All of this information and more is on the website, and the slide kind of shows you where it is under that prescriptions tab, Medicare Prescription Payment Plan. Medication adherence. We need you to take your medications as directed to help you get better and stave off some chronic diseases. These are just some ways to help remind us to take our medications. I personally use a pill box because sometimes noon comes around and I'm like, did I take my medicine this morning? And I'll look at my Tuesday slot and it's gone. So I know I did. You can set an alarm. There's smartphone apps. Consider getting a 90-day supply so you have your medications in the home already. If you're not taking your medications due to a side effect, definitely ask us, your provider or your retail pharmacist. There may be another medicine you can take, or maybe you can take this drug a different way or a different time of day. And also, if you're not taking your medicine due to cost, then consider the 90-day option because you get to save a copay. If you're not already using a preferred pharmacy, try that. And you can also ask one of our pharmacists for questions such on side effects and how to store. Under that prescriptions tab on our website, there's a lot of great information there. There is an Ask the Pharmacist. There's a link that you can send any question in and they respond to your email usually it's within 2 days, And lastly, medication therapy management. So if you receive this letter, the copy of it's on the slide deck, you are eligible for our medication therapy management program. Eligibility, members must have at least 3 chronic diseases such as like asthma, COPD, high blood pressure, high cholesterol, are taking at least 8 medications per year, and are likely to incur like a high total drug cost. Okay. Once you're determined that you're eligible based off of this criteria, you'll get a letter in the mail. But if you don't get a letter in the mail and you still want to talk to a pharmacist about your medications to get a comprehensive med review, you can do so by calling the 800 number that's on the screen. There's also, under the prescriptions tab on our website, under ways to save money on your prescriptions, there is a link there that shows you how you can call to get a free medication review. And that is my time for today, so I'm going to pass it on to Ryan.
Thank you, Danielle, and a lot of great content there. I know the elimination of that coverage gap, the donut hole. What an amazing update for this year, and that's really a historical change on the pharmacy side of the house. So great news and great updates by all of our panelists. Thank you. A lot of content covered there. We do have another minute here, so we'll squeeze in a couple questions. Mike, I'm gonna go back to you. We haven't heard from you in a few minutes here, but one question came in: how do I take advantage of my benefits when I'm traveling? I know you covered that a little bit, HMO, PPO plans, but can you just reiterate some of those points?
Well, in terms of what benefits, I guess, if we're talking about fit-on, obviously there's facilities throughout the United States that they can go to, and Sarah probably could address that better than I could. But as far as the health insurance or your insurance itself, I just reiterate that you've got, urgent care, emergency room anywhere in the world. So, if you are in Virginia and you cut your finger and you're going to go to an urgent care facility, get, stitches, and if you're having a heart attack or a car accident, you're going to go to the hospital emergency room. So, as far as other benefits, again, depending on the plan, if you're working with an HMO and stuff, you're going to want to try to stay in network for all of those services. So I don't know if that explains it any better, Ryan, or not. I couldn't tell you. Maybe you could tell me.
No, I think so. I think the big thing there to understand is the flexibility with all of the plans with the worldwide urgent emergency care. And the important thing with emergency care is, anything part of that emergency event, you're treated as an in-network patient. So a lot of flexibility there. Nice segue though, Mike, because there was a question that came in, and I'll lob this one over to Sarah. How do I find a participating gym with Fit On? Can you just revisit that?
Yeah. Absolutely, Ryan. So what you'll want to do is go on to actually the Fit On website, and you can go directly to the Fit On website and go to, there's a tab at the top that says fitness locations. And from there, they have, it'll pop up a screen with possibly your location if it's, I think that works with your computer, but I'm not sure how that works. But you can also just, there's a search function at the top of that screen where you can type in a gym and also your zip code to find out what locations or what gyms are in your location.
Great. Yeah, and I did see that Wendy had published those links in the Q&A section of the chat. So please take a couple minutes. A lot of helpful information there, quick links to reference. Also just know, and kind of to bring this full circle, Mike addressed all of the areas where we can provide support. Know that customer care is here for you as well. You can walk into one of our retail sites, answer those questions directly. We have our broker staff that can certainly support you, kind of run quarterback for you if you've worked with a broker. And then we have our field staff as well. So a lot of resources. We're here to help. As we wrap up today, because we are a couple minutes past the hour, I do hope that this information has been useful. A lot of content shared. Again, some great resources in the Q&A section, quick links for you to reference. But we also, truly value and, want your feedback. So a couple of things, there's going to be some opportunities for you to share feedback with us. First, after this session, you'll receive a post-event survey. It'll come to you via email where you can provide feedback and request additional support. Second, every year in the spring, some of our members will be randomly selected to participate, and it's a pretty detailed satisfaction survey and ask you about your experience with the health plans, some of the benefits that we talked about today, things like your ability to schedule a doctor's appointment. Not everyone will get this survey, so important to note this doesn't come out to all of our members. But if you do receive it, we do ask that you take some time, fill that out. Your feedback is what really guides our company and the services that we provide to our members and our community. So we definitely welcome that feedback and encourage it. With that, we're a couple minutes over, but I do want to thank everyone for their attendance. I hope you found this information helpful. And again, want to thank our panelists, a lot of information there. And just in summary, we're here to help. Please don't hesitate to reach out should you need anything, number of channels for support. So thank you and have a great day.